Hello, everyone, and welcome to this special episode of MedAI Web Hour series. I'm Shah, and I'm delighted to have you all here for an engaging session on how AI and technology are shaping the future of healthcare. We have two distinguished and esteemed speakers today, each bringing an unique perspective to this discussion. First up, we have Dr. Sinjan Ghosh, a cognitive and behavioral neurologist with extensive experience in neurological disorders and brain function. His work focuses on how technology and AI can improve neurological care. And today he will be speaking on AI in neurology, exploring how artificial intelligence is revolutionizing diagnostics and treatment in this field. So, welcome, Dr. Sinjan. Next, we have Dr. Atul Tiwari, an assistant professor in pathology, who is passionate about integrating technology into medical education. He strongly believes that physicians can benefit from understanding the basics of coding. His session on Introduction to Coding for Physicians will shed light on why learning to code can be a game changer for doctors. So, welcome, Dr. Tiwari. And moderating today's discussion is Dr. Aishwarya Sharma, who will guide us through these insightful presentations and ensure we dive deep into the transformative role of AI and coding in healthcare. So get started and over to you, Aishwarya.
Thank you so much, Hetvi. Good evening, everyone. I am Dr. Aishwarya Sharma, and I warmly welcome you to this Med AI Web Hour, an initiative by Doctors AI in collaboration with MedSynapse. So, this is our second episode of Med AI Web Hour, a platform that we launched in January 2025. And since then, we meet every second Thursday of the month to explore the intersection of medicine and artificial intelligence. In each session, we bring together expert speakers to share the insights on how AI is transforming clinical practice, research, medical innovation, etc. So tonight, as Hetvi mentioned, we have two distinguished speakers with us, Dr. Ghosh, who will discuss the role of AI in neurology, how it's shaping the diagnostics, the treatment strategies, and the patient outcomes. And we have Dr. Atul Tiwari, who will introduce us to the coding. So, as medical professionals, we are often towards the clinical side of AI, but understanding its tech side can be empowering as well. So, Dr. Tiwari sir will guide us through the essentials of coding, helping us determine what's useful, what's not, and also he will give a hands-on demonstration on how coding is done for doctors. So this session is designed to bridge the gap of medicine and AI, ensuring that we as doctors stay ahead in the rapidly evolving landscape. So let's dive in. We have with us Dr. Ghosh. Sir, can you please project the CV slide of Dr. Ghosh, sir? Heathry? Yeah. So Dr. Ghosh, after completing his neurology training in Kolkata, he pursued a clinical fellowship in cognitive and behavioral neurology. He is an executive board member of the Alzheimer's and Related Disorder Society of India, Kolkata chapter, Kolkata Neurological Association, Cognitive Neurology subsection, and Temurti Center for AI Research and Education in Medicine, University of Toronto, Canada. Here to you, Dr. Ghosh, sir.
Uh, Thank you very much, Dr. Aishwarya and Hetvi, for the kind introduction. So, at the outset, I would like to thank the whole MedSynapse team and especially Dr. Amit for inviting me for this wonderful session, and I'm honored. So, I'll be talking on artificial intelligence in neurology. I'm Sinjan. I'm a cognitive and behavioral neurologist. So, let's start. So, next slide, please. So, artificial intelligence is transforming the landscape of neurological care and research. I would also like to emphasize that brain is one of the most complex machines under the sun, and its potential is immense and the intricacies are unfathomable. So, the basis of artificial intelligence and the foundation has been derived from the concepts of cognitive neurosciences. So, AI technologies such as machine learning and deep learning are being leveraged to improve early detection, diagnosis, and treatment of neurological conditions. I'll be discussing on these topics today. So, these systems can analyze vast amounts of data, including medical records, genetic information, neuroimaging, biomarkers, etc., associated with the disease, and that might help the physicians in detecting things that human eyes might have missed. Next slide, please. So, as clinicians, we've learned over the years that we need to have a mental algorithm. When we see a patient, we take the history, we do physical examination, and we order some investigations. But before that, we need to have a plan. So, first of all, in neurology, as we know, it is a deductive science, and we need to localize the problem. So, where is the lesion? We have to answer this question. That is, where is the anatomical localization? Whether it's in the brain, it is in the spinal cord, or it is in the peripheral nerves. Then we try to answer the question, if it's in the brain, then what is the pathology? Whether we are dealing with a stroke, that is a vascular pathology, or whether we are dealing with a neoplasm or a brain tumor. And then when we answer that question, we come to how and why it happened. For example, if the patient is suffering from dementia, a Parkinsonian syndrome, or an epileptic encephalopathy syndrome. Then we come to the etiology. So, if it's a case of dementia, then we establish that whether it's Alzheimer's dementia or a vascular dementia. Next slide, please. So, as clinicians, it is very important to know that there's a phrase called what your mind doesn't know, your eyes cannot see. So, from our years of experience and shared skills and knowledge that we've gathered, when we see a patient or when we have a problem in our hand, we try to retrospect or we try to match it with patterns that are known to us. So, first is retrospection. Then we try to implement or apply those information or knowledge or skill into the problem at hand or the patient whom we are seeing. So, then comes the relevance. And then we put together everything like a puzzle and try to come to a conclusion as to how to diagnose the patient and how to prognosticate and what are the treatment options and what are the chances of survival for this patient. So, this is basically what the AI does. So, this aspect of the human brain is being simulated in an AI model. Next slide, please. So, in the context of memory formation, I would like to mention here that there's a term called long term potentiation. It is considered a cellular mechanism that aligns closely with the Hebbian model. I'm not going into the details of the Hebbian model, but essentially it means that when two neurons fire together repeatedly, the connection between them becomes stronger. So, the famous phrase is cells that fire together wire together. So, if we think of a memory, it brings back or evokes a lot of other associated memories as well because the neurons that fire together wire together, or those who are wired together fire together when we try to recall. Next slide, please. So, as clinicians interested in artificial intelligence, I would recommend all the healthcare professionals to go through this wonderful book by Dr. Eric Topol. He is an American cardiologist, scientist, and author. So, in this book, he discusses a very interesting concept of doctors without patterns and doctors with patterns. So, when we see radiologists, pathologists, and dermatologists, so with their knowledge and expertise, they are dealing with pattern recognition. For example, in radiologists, they try to look at the scans and x rays and look at specific set patterns. Pathologists look at the stained slides, the histopathological slides, and they come up with a diagnosis. And same for dermatologists, when they look at skin lesions, they come up with a diagnosis by pattern recognition. So this is what an artificial intelligence also does. So what we do in within a fraction of a second, we try to train the AI model to do that, or to improvise and to help us in our clinical diagnosis. Next slide, please. So, I would like to explain this concept of the human brain, which can be extrapolated to any AI model. So, do you remember when, how, and who taught you the meaning of the word elephant? Most of us would not, because we know how an elephant looks like or what the word means, but we don't specifically remember the time or who had taught us. So, this is known as semantic memory. Semantics or word meaning that we've acquired over the years, but we don't specifically remember the specific episode when we've acquired that information, but we know it, right? So, when we see an object which is known to us, for example, a ball, we when we see it, when we look at it, we know the name, we know its action, we know the colors, even when it's available in different sizes, shapes, and colors, and how it acts. So if somebody throws a round shaped object which looks like a ball at us, we try to catch it. If we miss it, then we might get hurt. So this is what we've learned over the years. If we look at the second model, the red area, which is the anterior temporal lobe, is the area where all these bits and pieces of information that we've gathered through our senses are interpreted and decoded to. So these are basically the semantic knowledge. So when we look at an object, we recognize it. That's the semantics. So this is also simulated in an AI model. So we'll see. Next slide, please. So in machine learning and deep learning. So for deep learning, it requires lots and lots of data, huge data sets, and they are more accurate. So we'll learn how the machine learning and deep learning processes neurological data, AI-driven pattern recognition in the brain activity, and examples of AI-driven software in neurology. Next slide, please. Yeah. So here we see neuroimaging approaches. For example, MRIs or CT. What they do, they acquire the signals, they extract the features, and then using an AI model, the deep learning model, there's a pattern classification, and then that helps in diagnosis or rehabilitative plans. So in deep learning, there are different neural networks such as convolutional neural networks, recurrent neural networks or RNNs, and generative adversarial networks. I won't go into the details of the technicalities, but what they do is they segment the images, similarly the feature extraction, and then eventually we come to a diagnosis. And then a human clinician, a radiologist, actually looks at the diagnosis and tallies it with what he has inferred. Next slide, please. So, like the input images, the AI software looks at the input images. Um, so, when it's training, so the deep learning with the help of these neural networks and various layers, it stores the information and it learns. And eventually, when it's shown newer scans which are not labeled, then they come up with the diagnosis of, say, glioma, hemorrhage, ischemic stroke, or whether it's normal. Next slide, please. So, like if there's an input image, it breaks down when during interpretation, it breaks it down into pixels, layer one, then it identifies the edges, combination of edges, then identifies the features, and then combination of features gives the final output. That is either a normal brain or if there's a pathology. Next slide, please. Now, when you see a child learn, there are different types of learning. One is supervised learning. We tell them, so this is a pencil, you hold it like this, you write with it. they are available in different sizes and colors. So that is the supervised learning. Unsupervised learning is they are by themselves. They try to learn from the experiences. And reinforcement learning is when we tell them, so you do not do this. This is not right. So either in the form of punishment or reward, that is negative reinforcement or positive reinforcement, they learn things. We've learned the moralities and the ethics and how to live in a society, right? What are the right things to do and what are the things we shouldn't do. So like this, AI models have three forms of learning. So supervised learning, we are working closely with the team of data scientists who have developed a model with the help of ADNI, or Alzheimer's Disease Neuroimaging Initiative. Next slide, please. I'll just come back to the previous slide. So this ADNI, they have a huge data set of images, and so what they do is they feed the AI algorithm and they train the AI algorithm, and then uh, using the real world data, they try to interpret as to how accurate the AI software is. So first of all, it needs a labeled data set which is provided in the ADNI. So a clinician, a radiologist have provided their clinical diagnosis and the neuroimaging diagnosis. They've trained with that, and with the help of this algorithm, in our population, in our patients, they are going to see whether they're predicting accurately or not with the help of a radiologist who is going to say this is right, this is wrong, or this is almost accurate, this is not. Unsupervised learning, there's no label data sets. Learning is based on pattern identification. So there are multimodal patient data. It's mostly explorative. And then reinforcement learning, as I mentioned, it's mostly for drug delivery systems based on punishment or reward. Next slide, please. Yeah. So if we look at this AI generated report of a scan, so we can see on the top left, so it is trying to detect whether there's hemorrhage or not. Because in acute ischemic stroke, we have to thrombolize the patient or give an injection. There might be chances of bleeding, but if the patient already has a bleeding, we might not give the injection. So we look at the cerebral blood flow on the top right corner. We look at the angiogram of the brain, and we can see that middle cerebral artery is cut off. Next slide, please. So similarly, there's a large vessel occlusion or LVO detected on the right middle cerebral artery. We can look at the cerebral blood flow and the area already damaged. So if there's a penumbra region or salvageable region which is dying but still not dead, then we can actually save the patient by re-establishing the flow by doing a mechanical thrombectomy. That's how we take the decision. Next slide, please. Okay, so here similarly, the suspected hemorrhage, top left image, large vessel occlusion, and also the aspect score, which is important, Alberta Stroke Program Early CT score, which is usually done in stroke settings, acute stroke setting in stroke ready hospitals, where they see the area of the brain, the regions of the brain, for example, the caudate nucleus, internal capsule, and which regions are affected. So this where time is of essence, time is brain, where every minute billions of neurons are dying. AI can help the clinician detect subtle features of early acute stroke. Next slide, please. Now, if we come to the natural language processing. So, when we see a resident write a history, we look at the history or we listen to it and try to pick up relevant points which are important to diagnose the clinical condition. So, like that, natural language processing, on the top right, you can see that from a clinical history, from the electronic health records, it can actually come to a conclusion about the provisional diagnosis. And just below, you can see a OpenGPT program actually answers a question when the patient or their caregivers are unsure as to whom to ask when there's an acute problem. So they are saying that if the seizure or epileptic fit lasts for more than 5 minutes, you need to transfer the patient to the hospital right away. And if there's a weakness, you need to talk to a doctor. And if it's the first seizure episode, then you need to talk to the doctor as well. So these are based on nice guidelines, which have been used to train the GPT. Next slide, please. So a histopathological slide showing Lewy bodies in blue, uncertain Lewy bodies in red, and purple are not Lewy bodies. So these help in um, identifying the different pathological entities. Next slide, please. So AI helps in predictive analysis, the disease progression, early detection of neurodegenerative disease, because disease modifying therapies are being made available. And so early diagnosis is essential. AI models also analyze the genetic and lifestyle risk factors. Next slide, please. So we wrote a book chapter on technology and AI in dementia. So my co-author, Dr. Danseru, he's a computer scientist, and they have company. They have AI software where they feed the electronic health records, the history, the clinical examination findings, neuroimaging, biomarkers, the fluid biomarkers, and also the genetic test results, and try to predict whether an individual who doesn't have cognitive problems but has a positive family history of dementia, what are the chances of them developing dementia later in life. So there are various wearable technology like accelerometers, which actually assess the gait, sleep, and physical activity in dementia. So sleep, as we know, is very important. It can affect cognition, and in cognitive problems, it can again affect the sleep. So monitoring gait is also important because we need to stratify the risks of falls. Sleep markers are also present, and also life space behaviors. Next slide, please. So these are the different gadgets or devices which are used to pick up the vital signs, whether the chances of impending unconsciousness is high or not, whether the person has fallen down or is now unconscious or having an epileptic fit or having disrupted sleep patterns. These are detected with the devices. Next slide, please. So, as we can see, a smartwatch might help in navigation. A patient, an older adult or an elderly individual, they can help them navigating to the toilet. As we know, in advanced dementia, they lose the sense of direction. So that's how these gadgets can help them. So if you look at the bottom image, so they have actually traced a path. The green path is the correct path, and the red is the wrong path. So the chatbot actually helps the granny by saying, "Granny Chen, please turn right," and they can help the individual. Next slide, please. So AI in neurorehabilitation. So there are robotics, brain computer interfaces, and virtual reality and AI driven therapy as well. In dementia patients, we see there are virtual reality softwares where they play old memories. Now, next slide, please. I'll be discussing about the brain-computer interfaces. So there are medical BCIs or brain-computer interfaces where they help in neurorehabilitation, allowing patients to regain lost motor functions and improve their quality of life. Communication BCIs in locked-in syndrome or patients with aphasia help them in communicating. Entertainment and gaming industry also helps in with the BCI has been implemented, and it can also enhance cognitive abilities. And especially there are gadgets where a blind person with a BCI applied to the visual cortex might be able to see the images. Next slide, please. So this is a BCI model. EEG or the electroencephalogram is a non-invasive model. We do EEG every time in epilepsy patients, but this is used in BCI as well. There's an invasive model as well, which is known as electrocorticogram, where uh, with the help of a neurosurgeon, the electrodes are placed on the brain. And then there's binary digitization, signal processing, and then the device control, like an artificial limb or locomotion. Next slide, please. So here we can see the EEG and ECOG placement. On the right hand side, it's a real time image of placement of electrocorticogram, where the neurosurgeon needs to cut open the skull. and place the electrodes. This is an invasive one. Next slide, please. So AI assisted treatments, AI helps in epilepsy management where quantitative EEG analysis and also continuous EEG monitoring to detect epileptiform discharges in acutely ill patient, and also stroke detection I've mentioned. And the treatment planning is accordance to the patient profile and the AI predictability along with the help of the clinician. Next slide, please. So as we can see, this is the application of machine learning. They access the health records, the omics data, that is the proteomics, metabolomics, etc., neuroimaging, and clinical assessment. They stratify the patient and helps in personalized drug regimens. There are genetic tests which can actually stratify the patients who are prone to develop adverse reactions to specific drugs. Drug repurposing, as we know, gabapentin was initially introduced as an anti-epileptic agent. It is used in neuropathic pain as well. Now, clinical assessment aids can be helpful in patients with disabilities. Neuroimaging I've already discussed, and also the biomarker assessment um, is helpful. Next slide, please. Now, we have smart watches, we have smartphones, but there are smart houses as well. So imagine an elderly individual is living all by themselves in a house, but they have the next of kin or their relatives or their children living elsewhere but monitoring them. So, whenever they are inside the bathroom for more than 20 minutes, there would be an alarm that would be triggered, and they'll inform the relatives. When the living room door is open, the light will immediately turn on to prevent falls. And when motion is detected at night, the light will turn on to prevent falls again, because we see a lot of mortality and morbidity following fractures and also head trauma. Next slide, please. So, as we've discussed, AI helps in improve diagnosis, enhance disease prediction, personalized treatment plans, clinical decision support, efficient data management of large data sets. It is helping in drug discovery and early intervention in neurodegenerative disease by helping in diagnosing it early. And also telemedicine. I've worked in Toronto, I was working with virtual behavioral medicine, which is a telemedicine platform for advanced dementia patients. Next slide, please. So, the challenges and ethical considerations, we need to be cognizant about the data privacy and patient confidentiality. We can't post anything in social media without consent, and the data should ideally be anonymized and de identified. Next slide, please. So there are different biases that can arise from data used to train AI models as well as from the design and implementation. So healthcare providers and AI developers must carefully consider these issues and take proactive steps and efforts to promote equitable access to technology and ensure cultural and linguistic sensitivity. It is relevant for our country where we have a lot of languages. To make AI models accessible, we need to bring it in different languages. And the need for specialized training of healthcare providers is essential. Next slide, please. So, to conclude, neurologists will not be replaced but will orchestrate these different assistive devices. AI software use is most mature, that is, tried and tested in hyperacute stroke, as I mentioned, and AI software should be regulated as a software as medical device. And it is essential to have high quality data standardization because the input data is important and it would determine the quality of the output. So the accuracy should be taken care of. Next slide, please. So, in Eric Topol's words, usually it's always man versus machine. With few exceptions, what it should be is man plus machine. Next slide, please. So, as healthcare professionals, we need to bring together AI and compassionate care. Let there be light. Thank you so much. I'll be happy to answer questions.
Thank you. Thank you so much, sir, for such a comprehensive session. Your insights have shed lights on how AI is not just like a futuristic concept. We are already transforming clinical practice using AI today. Um, So, in like AI neurology is definitely advancing quite rapidly, but implementation in the daily clinical practice, like I want to know more about it. Like, how do you, what are the practical barriers as neurologist do you face while using AI in everyday clinical practice?
Yeah. So as I was discussing, we are working with a team who have already trained their AI model with the help of ADNI data, the Alzheimer's Disease Neuroimaging Initiative. They want to implement it. So they need a radiologist who actually has to label the real world data, that is the Indian data. So we are dealing with ADNI, which is European or North American data. So we need to have our own data. But due to the time constraints and the busy schedule, it is very difficult for a radiologist to actually spend that amount of time to label the data. These are the real world problems. Once done, so it's ready to be started. So for that, we need multiple radiologists from multiple centers to collate the data. We have huge data sets in India, but the problem is with the documentation and the time to document. So we need to bring together a lot of people who are interested in AI, who would spontaneously want to work with it, and then we can collect the data, and the data set would surpass any other Western countries. So
Rightly,
that's the
right.
challenge. That's the challenge because the time and the patient load, the doctor-patient ratio, that's the downside in our country.
Very rightly said. I hope that all the postgrad students attending this session get inspired to, take that step towards data collection so that we can also have like a solid database. There are a few questions, audience questions coming as well. One of them is, can AI help in diagnosing neurological diseases for which there are no confirmatory tests available, like benign positional vertigo, etc.?
Yeah. So basically, we need to feed the data. Uh, the clinical eye is something different. As I mentioned, the human brain is the most complex thing ever. Say, so eventually it will develop, I guess. So what they do is pattern. They recognize the patterns, but the variations, the normal variations, we need to feed that data as well. And coming to the emotion recognition, not only what I go, but emotion recognition. If somebody tells you that, doctor, I am okay, but if you are a human clinician, you will detect that there's sadness. They are not making an eye contact. Their tone, their pauses, their hesitation. So that tells you a lot. That is what is known as social cognition that we possess. That makes us different from a machine. So if the machine hears that I'm okay, they might think that okay, everything's fine, but the human would identify. So there's a long way to go, and we need to feed the right kind of data.
That's right. So whenever there is AI, there is going to be one ethic. The question for ethics, like what are the biggest ethical and clinical challenges in integrating AI into neurological decision making? Uh, what are your thoughts on that?
Right. I think we can't blindly rely on it because there might be diagnostic errors. So, as I mentioned, the tiny nuances of so I'll give you an example. Say, for example, ADNI data. They have categorized the brain into mild cognitive impairment, dementia, or normal cognition. But when we see a patient, real world patient, sometimes just by looking at the atrophy pattern, we can't say that the patient has dementia. A highly functioning individual, say a surgeon, a doctor, an aeronautical engineer, they would be resilient to brain shrinkage because when we look at the scans and when we look at the patient is not that bad in terms of cognition, but the scan is much worse. So there's a dissociation. We need to take that into consideration, which is known as cognitive reserve. So the education, knowing multiple languages, these act as resilience factors, and so that is something that should also be taken into consideration. So
Oh,
that is
that's
where the human mind comes in. So I think AI can augment diagnosis. We should
That's
not
quite
rely
interesting.
blindly on it.
Yeah, yeah, definitely. There is one question from my side. So, what do you think will be the next big breakthrough that we should expect of AI in neurology?
One is what Elon Musk is trying to do, to
Yeah, Neuralink.
implant a brain chip. I
Yeah,
don't know how it will go, and there are
yeah,
there are people who are opting for it as well. So it's hard to take that decision that you don't have a brain tumor, but you allow somebody to cut open your brain and implant something. That comes with risks. So
right.
that is going to be huge, but that comes with various ethical issues as well, because these can be hacked. So if it
Yeah,
is hacked, then you can be controlled by somebody else.
yeah.
So we need to be careful.
Yeah, we can have a totally like an entire session on Neuralink on Doctor's AI maybe someday.
Absolutely.
Thank you so much. Thank you so much, sir,
Thank
for
you.
your time.
Thank you. My pleasure.
And thank you for taking time out from your busy schedule. Um, we will proceed further for our next speaker, uh, Dr. Tiwari, sir. Hetvi, if you could. Thank you. So we have this second session on coding, how coding is important to learn for us as doctors. So the session will be taken by Dr. Atul Tiwari, sir. He's an assistant professor at GMC Chittorgarh. He's a consultant at MedPrime Technologies and a research wing leader at Doctors AI. He has published several original research on AI in healthcare, developed and published medical mobile 3D education games on Google Play Store. He's proficient in no code AI tools and programming languages like Python, Flutter, Kotlin, etc. Thank you so much, sir, for agreeing to take this session. The floor is all yours.
So most of you are connected with me in the Dr. CI group, and some of the new people. I'm Dr. Atul Tiwari, and I mostly teach pathology, but also I do work in programming for mainly for AI, but not just for AI because I know programming. So I work for many different things, which I will show you a little bit glimpse, and I will try to convince you why you should know basic understanding of programming. So, why should doctors learn programming in today's era when we are working in the AI era? It is a new beginning. It is like kind of revolution, like when typewriters replaced by computers. Nowadays everything is getting, we are afraid of everything getting replaced by AI. So these things are we are reading now and then. So why should doctors learn programming? There are automatic repetitive tasks in our life, enhancing research capabilities, AI and medical imaging, data driven medicine. Everything is evolving. I will show you example of each one of these in my upcoming slides, but let me share a very brief story, like which is one of the reason why I advocate everyone to have a basic understanding. I was approached by one of a startup. I won't name it for obvious reasons, but what that startup was, they posted a gig for a freelancer to create an AI model for uh, breast cancer, which they want to use in mammogram. But the data set they shared was of histopathology slides. So these two are kind completely different thing. Many of the people basically they are from engineering background who don't know that histopathology and radiology are two separate branches, and it's not like that. If one can create a model of histopathology slide, it can be used for any purpose in mammograms. So I also said that okay, I will make that model if you want it, but you won't be able to use it in radiology. So this is one of the thing that as a doctor I understand. There are many several example in my life that I have seen that we need someone who understand both medical and technical language, so that it can be easily translated to engineers, and engineers can easily understand medical lingo. So that is one of the reason. Now the next question that is being asked, like I am also a pro advocator of using no code AI tools. I also teach it in Dr. AI course also, one of which is Orange Google Teachable Machine. When there are these kind of tools, then what is the need of learning programming again? So although the learning curve for the traditional programming is steep, and no code tool is like if someone can use how to use a PowerPoint presentation or how to use WhatsApp, he can use no code AI tool also. But then even though a little bit difficult, but then it opens our mind to a different level. Basically, we get a vision on a problem statement and try to break it in several steps, several easy steps, and try to solve it one by one. That's how we learn. And while doing so, we find out a new way also. At least I did this, and from the people from whom I learned it, they did this for many years. And during the journey we created some awesome programs, some of which I will also show you. Then there are certain use cases that is for no code tools. Although they are easy to use, but there is limitation. They can be used for a smaller data set. They can be like proof of concept model training, automated data analysis, and report generation can be done. But if there is the data set is huge, it requires data cleaning and several deeper steps, then basic understanding will help. I'm not saying that you do it all by yourself. It is not required. There are engineers for that thing. But if you and your engineer counterpart both can sync each with each other, then it would be easier. For example, if he says that I am using this standard type of algorithm like random forest, just for say, this is one of the terms that we use in AI machine learning aspect. But then you can also mention that in one of the research paper that I have read, sir, the XGBoost algorithm was shown to have better implementation. So you can say this once you know the basics. Otherwise, it would be a very difficult term for you. And XGBoost, random forest, SVM, these are not just the only terms. With when the time advances, things evolve. I started learning programming somewhere around 99 or 2000. Back then, the programming languages which I started with were the Fox Pro and the Basic. We don't even use those kind of programming languages right now. But the concept which I learned at that time are helping me till today. So the concept is same. The languages will evolve. Then tools and languages for no code tool, I already mentioned that there are Orange, Google Teachable, Hugging Face, AutoML. So many tools are there. But for coding, if we are working in AI domain, then Python would be the best start. Apart from that, R, SQL, I will mention about these in a later slide also. Uh, Then there is a thing about scalability. No code platforms have limited scalability, so that's why we can't do advanced tasks. But if you have a better understanding of programming, then what can be done is I also teach this thing to my students who are learning AI from me, that you start with no code tools such as Orange. Once you have a basic understanding how does machine learning work using without any programming, once you have a grasp at that, and if you have a basic understanding of Python, you just need to write 5 to 6 lines of code to make your model more better in a better way. And with the advanced technology like we have chat gpt now, it is also helping us in writing programming also in the code section also. So if you understand that how does a code look like, what does the code will do, so you can just ask ChatGPT also, like I want to integrate XGBoost algorithm in my code, write a code for that. It will write like 5 6 line of code, and you can integrate it at the relevant place. But what would be the relevant place? That those are the basic things that you should understand, and that will be easily understanding. You can easily understanding like if you have a like crash course of few months with a decent practice, you can easily understand. Now, which programming language to learn? These are some of the like 40 topmost programming languages of the last year. There are so many programming languages out there in the world, depending on your use case. And I will specifically say, if you are a doctor and if you are thinking about programming, and just first ask yourself whether you want to do a full-time code, whether you want to be a full-time coder. Because in our doctors AI group, when we ran an internal poll, we also found out that there are several doctors who are passionate to learn programming to an extent that they want to be a full-time coder also, like they want to build something in healthcare on their own completely without the need of any engineering counterpart. If you are that then you will need more time. But if you are a hobbyist, if you want to become a hobbyist programmer, then you need to select a domain. Just for example, if you want to learn in AI, then Python is a good start. But if you want to create a mobile game, then for Android, that Android Studio, the Kotlin would be a good start. And then if you want to build a for iOS, Swift would be the language that uses C, C++. Then for web designing, HTML, PHP, those are the starting points. So for every domain, there is something. Then, for example, I will show you in the next slide. For anatomy people, when I had a chance, like basically, I saw a loophole in recently in Indian medical education system. Like we had lack of faculty in anatomy department specifically, and thereby I got an idea like people can learn using VR headset or even through their mobile. So I started working on creating human anatomy 3D game. Basically, right now it is a very primitive game, and in this, what we can do is like take out the bones and orient it like we do used to do in our anatomy viva, hold it in an anatomical position, identify the landmarks, and all those sort of things. And I put it in a game format. So this was done in Unity. It is a 3D game mobile software. It is little bit advanced, but the purpose to show you this is that once you understand any programming language, then it is not difficult to jump onto advanced tasks if you have the time or the willingness to do so. So I did this in I think around 6 to 7 months, and I did it only in my free time only. So this is for anatomy. Then there are use case for pharmacology people. So for example, if anybody in the audience is from pharma background, or if anybody is interested in drug discovery, then there are aspects of molecular dynamic simulation or molecular docking, where like during COVID and after COVID, recent boom has been seen in bioinformatics, like how the drug discovery is like amplified using simulation techniques. So if you know basics of Linux and basics of Python, it would be a very easy thing, because we already know, as a doctor, we already know how drugs act, or the mechanism of action of drugs, the pharmacokinetics, the pharmacodynamics. Only thing is now we need to integrate that in a computer model, so that we can easily create another new thing using those things. This is a completely non-medical example of how I used coding, my coding knowledge. One of my close friend, he was learning a musical instrument, Indian musical instrument, on like Indian sargam that we use, like saregama. But on YouTube, he was seeing the notation was giving in Western notation. So he asked me like, how can, in the beginning phase, he asked me like, I'm finding it difficult to translate the Western notation into the Indian one, because if you know the music theory, then you will understand that it is not just a very easy translation. So I just created a simple demo web app, like you put your notation in the Western format and convert it into an Indian sargam. So once you know something, it's like once you know cycling, it you can do many things. Like it is not just like you can go to your college through cycle, you can go anywhere. So this is the advantage once you understand a programming language. Now coming back to our specifically like today's topic. So now I am limiting myself, like I am assuming that most of you are here to learn to understand how programming can help us in terms of working in AI domain. So there I would suggest start with the Python. Once you have a decent understanding of Python, or if your job profile requires you to work more in statistics, then simultaneously you can learn R. This is more of a statistical kind of task. So people working in PSM domain, or people working with the machines who have which have enormous data, for example, biochemistry machine or the flow cytometry machine, they have huge CSV files. To analyze those, R is a good starting point. Then there is data handling. For example, if someone is working in a multidisciplinary hospital, and there are so many patient data, there are so many investigation. Although the complex programming part would be dealt by your IT team, but you know like what my data set would look like. For example, if I need a hospital ID, if I need patient name, age, gender, and the investigation, then I can give my inputs to the IT team, like how my coding software, how my EMR software should look like. There it would help. And then EMR, the GUI part, or the graphical user interface part of the app, can be built with the HTML or the JavaScript. So these four languages I recommend for the beginners. Now, next question is, how much coding is enough? So it is like from a drop to the ocean, there is no end. So it completely depends on your use case, but not to get overwhelmed, I will say, like, just basic, have a basic understanding like how Python looks like, how do we code. Just for example, if I want to print my name Atul Tiwari on the screen, what would be the syntax? So that is called a syntax. So some basic syntax we need to know. Now if you remember on my first slide, I mentioned that there are some repetitive tasks. So repetitive tasks can be compiled inside a loop or a function. I will give you one demo of a function in the end if the time permits. Then with these basics, then we can go into specific. For example, if there are statistical data, just to say like radiological data set is there or the patient data for diabetes prediction is there, then we use pandas and numpy kind of library. And to visualize in a graphical format, we use matplotlib and seaborn libraries. Lastly, if we want to create something very good in AI, then scikit-learn and the TensorFlow are the starting points. But you can't work in a TensorFlow until and unless you know the basic syntaxing and the loops and the function of Python. So that's why these are a step-by-step hierarchical. You can't just Google on like I want to use TensorFlow. It won't work for you, and ultimately you will get frustrated. Some of the practical use cases I will go quickly so that I can show you a real life demo also. So in AI assisted diagnosis, as Dr. Ghosh has also shown you some of the very nice slides with images, like in radiology, pathology, and other branches of medical system, where we use diagnostic parts. So AI is helping us. Wherever image analysis is being done, then deep learning part of AI is helping us to have a better diagnosis. And then there is automated data analytics. This data analysis, it is done by the machine learning aspect of AI. So like there is a statistical data of hospital records, and if we want to like uh, create a model, just to say vaguely, for any specific hospital or any specific locality, like what kind of patients I am seeing, or what is the trend of seeing the patients in a rainy season, something like that. It completely depends on how creative you can be. Then there can with the evolution of chat gpt, now everyone wants to discuss diseases also in chat gpt kind of chatbot format. So we can create a simple chatbot for patient queries, like if someone wants to know that my glucose level was this, and doctor in a medical approved medical app, my glucose has been monitored, it is being monitored daily. For I'm just giving you a vague example of a diabetic patient, and suddenly someday for some reason it got high. Like what would be the next step to do? So here I would like to quote the doctor's AI, one of the key member, like Amit Desar. He created a Madhu AI along with his team. So this is one of the nice examples which uses some part of programming in the backend. Then there is computer vision for medical imaging. Like I mentioned, for any image, any branch of medical science which deals with images. For example, in pathology, we use slides. In dermatology, then again for maculopapular, these are actually an image, like we see through eyes. Then there is radiology, X-ray, MRI, CT scan. All these are images. The endoscopy, these are images. So all of these images, they can be interpreted. And if I want to simplify it to a completely beginner person who doesn't know anything about AI, like Google or Facebook, they recognize our faces. Everyone must have seen, like when we upload a photo on a Facebook, like they recognize our faces and it tags us. So how does it do? Is it able to actually identify our face? No, it is doing something in the background at pixel level. Through that, it is identifying the algorithm that is it is using, that is the deep learning using computer vision. Then some of the real life example, for example, in radiology, like pneumonia, for pneumonia detection, tuberculosis, fractures, tumors, stroke indicators. There are so many examples on the GitHub that are freely available for you to start. The techniques that are being used, once you have a decent understanding of Python, then you can go with the TensorFlow or PyTorch. Any one of these you can start. And using the computer vision libraries such as OpenCV or Scikit, you can create a basic algorithm, and you can also publish your data or research. Similarly, for pathologists, there is whole slide imaging is being done at many centers now. with proper annotation, and we can create in-house and in-house diagnostic tools also. And why I am putting a stress on in-house diagnostic tools, because if you know a pathologist, or if you are a pathologist, you know that we use different types of stains, and the quality of stain differ from center to center. AIMS PGI, like higher institutes, they have one of the best quality of stains. They don't compromise with the price also. But when we work in a limited area setup, we need to compromise this with certain quality because of the financial crunches. Then if just for example, the institutes in the US or UK, they create a model to detect a tumor on histopathology slide, it would fail in our center because we don't have that good quality of slides. So basically, that it should be the same type of data on which the model was trained on, otherwise it would fail. So that's why, if we have a basic understanding, we can create an in-house tool, or we can just fine tune their model with our data set. Similarly, for the chatbot, for clinical documentation, for the patient reports, radiology report, or pathology reports, ICD coding can be easily integrated in this. So with a basic knowledge, we can do all of these kind of things. Now, most of the people who are new, they ask me like how to learn coding or from where to learn coding. There are so many online resources nowadays on Coursera, Udemy, very cheap, or basically. Not I won't like to use the word cheap. It is like fine, economically affordable courses are there on Udemy. Pick anyone. If you have time, then pick a decent one with like 40 to 70 hours of videos are there. Then you can get a data set. Just let's say you are a beginner, you don't have your own data set. Then in that case, you can use Kaggle. There are so many data set of different stream. For example, for pathology, for neurology, for radiology, every branch of medicine has some data set to work upon. You don't need to initially install any programming language in your laptop. You don't need to have even a high-end laptop. You can even do coding in your mobile also. I will show you how, using Google Colab, something called as Google Colab. It is free of cost, provided by Google, where I will show you one small demo. And lastly, if you want to go with like ChatGPT kind of chatbot, then Hugging Face is a good start. So this is one of the course that we are working with as Dr. CI team, with Neurology Skill Development Academy for certification course in AI in medicine. So here I'm showing mostly using the no-code tools, but one example I will also show using coding also. I also teach hands-on demonstration using Python for AI people. And now I will show you two hands-on demo. One is a very basic Python script for BMI calculation. Why I chose this? Because all of us are doctors. So for BMI, we know the formula. We just need to integrate with a small program. So just to give you a demo only, some of you might also think like, what is the need for creating it? While there are already there are so many free of cost BMI calculator available on the net. So it is just to demonstrate you how these calculators are being made on the web, so that in future, if your branch requires another type of calculator, you can use the same mechanism. You just need to replace the formula for BMI to your particular calculation. Another one is a very small example of HbA, analyzing the HbA1c level using pandas library. So this is the very small code that I created for BMI calculation. I will show you this one and HbA1c analysis one in the real life coding interface only. So to summarize, how to start: learn Python basics, work on the medical data. You can start with the Kaggle. Start with a small project. Most of the people also find it difficult, like what should they work on? So I always tell them, sir, just go to Google Scholar or Google, type your stream. For example, if you are working in biochemistry, just type biochemistry and then artificial intelligence. Go with your recent publication, see what are there. Just for example, if someone is has published some study using prediction, automated prediction using AI for lipid profile or for blockage, something like that. So you can start reading those paper and you can start working on those. Once you work on 3 or 5 projects, you will have a better vision and you can start on your own, your new innovative project also. So, to conclude, AI is already revolutionizing the medicine in multiple ways. Doctors don't need to become programmers, but they should be able to understand programming concept to empower them to integrate the AI into the practice. Then there is choice for no code AI. I always put a stress like not all doctors need to understand even the basics of the coding also, but with the advancement of the technology, we should have a basic understanding how things are evolving. So this is a demo of Google Colab. Before that, this is my profile on GitHub. I have posted some of the very good example of using programming. And I have released the codes free of cost. Anybody can easily access those. For example, there is histological stain normalization, WBC classification tool. You can easily go through those if you have, like, if you are interested in making those kind of softwares. Thereby, you can make something on your own. So this is the Google Colab interface. How do you open it? Just go to Google, type Google Colab. First link would be colab.research.google.com. So this interface will open. Right now I cannot show you entire demo of how does it work, but here is a connect button. You can go on to YouTube also, like if you want to know more about it. Hardly 10 to 20 minutes of induction would be sufficient for you to understand how Google Colab works. Basically, it is allotting me a free CPU right now to so that I can code. Once it is connected, then I just need to know some basics about programming. Right now, if I want to print my name on the screen, I so this is a simple command. Like I can just type print and then in small brackets within the inverted comma, these I just need to type my name. So this is how you can start. Then there are so many things, like there are variables, there are constants, there are functions. I can't go into those details in a single 20 or 30 minutes video. I have already, I think, overshoot the time, so I will be quick. So this is the segment. This is called a function from def. It is a function. So here I created a function because it would be my repetitive task. So remember my first slide, all the repetitive tasks can be compiled into a single thing so that I don't need to write or rewrite a thing again and again. So it will save many human hours. So here I created something called as calculate BMI, and inside bracket I am putting like what would be the weight and the height. Why I'm putting it? Because this is the formula for the for calculating BMI, weight divided by height squares, where weight is in kg and the height in meters. So this is the formula. So I just put the formula here. BMI is equal to weight divided by height uh, square. So in programming, whenever you learn any programming language, you need to understand basic understanding of some syntax. Like here in Python, we put the square like using double asterisks. Now if it is now you can give the different criteria, like if it is underweight or normal weight, overweight or obese. So now if I run this segment, here I have put like use that particular for function calculate BMI. Here it I have mentioned, so I don't need to repetitively rewrite or rewrite the things. So now it is asking me the weight and the height. For example, I mentioned weight as 80 kg and just to say height as 1.7. So now it is automatically calculating and it is giving me an overweight. Although I know there are beautiful softwares out there, but I'm happy that this is the first program that I created, like very with a very basic understanding of it, and it is created by me. That is another feeling you will get to know, like when you create something of your own. This is an example of like HbA1c level analysis. So this is one of the use case. Like I mentioned, someone when someone in from biochemistry background, he asked me like, "Sir, I want to make some research paper, but what should I work upon?" I instantly just asked them like Google on like what are the recent trends. Some HBO even she was popping up on the Google Scholar at the top. So I just took the example. I just wrote an example to demonstrate the patient ID, HbA1c level, and the diabetes status. This is a dummy data. You need to replace it with your real world data. So here, what is being done? I won't explain you line by line, but this is creating a graphical representation of the data. So here all the data set is being shown first, then there are like counting of done, like how many of these are normal, how many of these are diabetic or pre-diabetic, and then some plots were done. You can make beautiful plots like violin plot or like pie graph depending on your use case of the study. So uh, this is a basic demonstration. Now, if you are interested or if you want to know more, I'm stopping my screen sharing and I'm open for the questions.
Thank you so much, sir, for that session. We didn't mind you overshooting the time limit. It was very engaging indeed. So I think the only question remains is how to subscribe to your course on coding, because
It is
yes,
like most of our audience are connected to us on Doctor's AI group on also,
yes,
so they
yes.
can ask. They are already that certificate course in AIM. The first batch is already running. It is started on 26th of Feb, 26th of January. In 3 months, like in 42 weeks, we will train them. Then the next batch will start. So on Doctor's AI group also, you can message us, or you can connect with me on the LinkedIn. I showed you in my presentation, my LinkedIn connection link is there. You can ask me if I am free. I generally try to answer the queries. Like most of the time I get queries only for this thing. Like I'm a newbie. Basically most of the students, they just did their PG and now they are enthusiastic because contrary to our generation, the newer generation is more adaptable to computers and mobile. And since their childhood, they are seeing like things are being made. And with the help of ChatGPT, now programming has even become very easy. Once you have a basic understanding, I told you that circum part, I don't even know how does the music thing work. I just created some outline and then I asked ChatGPT, okay, I have a vision to create this kind of tool. And I just fed that. Then I found out that ChatGPT is writing a wrong code. Now I understand the coding segment. So this, I just copy pasted that code that you made a mistake here, correct yourself. I didn't correct that by myself also. I just asked it. Then ChatGPT introspectively realized that okay, this was wrong, so it corrected it. So that's how I made it within an hour. It didn't took me a day or 2 day. It hardly took me an hour, and it was an amazing tool. Some of my friends still use it.
Yeah, so that was going to be my next question. That one, we study that we can like learn to code, and the other part is the no code AI. But how easy or difficult is it to ask GPT to make a to code for us, and then copy pasting that code in the Google thing, and then
I give
like
you a question.
running?
Basically, the thing is, for even if you want to like use chat gpt to code completely code, you can even code and complete AI program from data cleaning to create a model. Nowadays the query window is quite large. A complete research paper can be done on single prompt, but the thing is whether it is doing correctly. Otherwise, we don't even need humans to publish the data. I can create a chat board, like it will automatically create a research paper every day. Just it will just took a random Kaggle data set. It will be just like I'm throwing a dice. Okay, one came to pick radiology. It will take a MRI data set. It will create some board, create some model, create some paper, and submit it to some research journal. But that is not the correct way.
Yeah.
Why? We should be there in between the loops. That's how we will learn. It is not like I want my machine to do everything, then what will I do? So to cut short, we should have a basic understanding of the programming. But even before that, I always advocate that don't just go for programming because I say so, or if you feel fascinated with the things that I do. Because I code in like I make animated movies also. That is another different thing. But then thing is, what field you are specializing in. For example, if someone is specialized in pharmacology, then he should explore the drug discovery area. I don't want until and unless he has a specific interest, I don't want him to create a surgery simulation app. Like how does surgeon work? Because for that he need to have a good understanding of OT also. How does an anesthetic work in a OT? How does surgery being performed? Like at what area the cut should be made? Because if a pharmacology people leave pharmacology people, if I am making a cut, I don't know how does the surgeon cut. I know pathology, how I know how do I cut the organs that surgeon sent to me. So if you are a pharmacology person, then go with the drug discovery. If you are a pathology person, make something with the pathology, keeping your domain in your mind. Then start. If you are specific that I want to go in the AI field, then start with no code tool. uh, I have a playlist. Just Google my name on YouTube. After that, no code tool orange. I'm just spitting out because already time was overshoot. Otherwise, I would have shown you 10 videos I have released free of cost. Anybody can see those using Orange. How you can create your first prediction app. I think I made a diabetes prediction app using no code tool. Once you have understood it, now I am confident that you are enjoying this journey because it is not for everyone. I don't like some of the branches in medical science. So I don't want to go. I don't want to go under peer pressure like it is booming in the industry. I should do an MBA. Why should I do it? So it is the same thing. Just have a taste of it, and if you are enjoying this journey, then go with the advanced thing. And in advance, first thing would be basics of programming.
Rightly
So I
said.
don't
So,
recommend anyone to go on the day one for the programming.
rightly said. So there are a few questions from the audience. One says, what are the most common coding errors physicians make and how can they be avoided?
Coding errors, it completely depends on the ability of the programmer. Because in coding, the error occurs if the coder doesn't know certain things. Just for
Yeah.
example, I showed you demonstration of the Python code. In Python, at the end of the code, we don't put a semicolon. It is
Yeah.
a button just after the L. Generally, most of the people or most of the doctors don't use it because it is of no use to us until and unless a specific clause is being in grammatical English. But in many programming languages, just for example, like C, C sharp and JavaScript, at some places, the colon sign is used. So if we don't put it, uh, right now there is ChatGPT. So if I get an error, I just copy paste it and ask it just analyze my code and find out the
Right.
error. It helps me because now I need to work faster. So there is no shame in accepting like I'm using the help of ChatGPT. But when I started in 2000, if I wrote a code of say about 100 pages, and if I missed to put a semicolon at some place, it will throw an error. It would ruin my day. Because every time I'm thinking, I created correct logic. For example, for BMI formula, wrote the correct formula, I wrote the correct function. Why it is not working? Because sometimes programming language give you the error correctly, or sometimes the syntax is so vague that we need to google it. So there can be n number of error, not just one. For example, if you run the same bmi program in your laptop, if python is not properly installed, that code won't even run. Then the error would be completely different. For example, if someone is making a radiological app, x-ray analysis app, for that deep learning with computer vision, it would be required. So I mentioned the TensorFlow library, if someone remembers, for the like OpenCV is required. So if someone forgot to import OpenCV, import is another syntax to load in the memory ready-made libraries. Programmers have done a beautiful task. They have simplified so many things for us who don't frequently program. So I just need to write import OpenCV, enter. If I forgot to load that line, then I can't load an image and analyze that image.
Right.
So there can be, that's why I say there can be n number of image errors, not just one or a hundred or a thousand.
Mostly like technical errors, which you will learn to rectify as you practice
Yeah.
more.
And
Definitely.
to rectify those for beginners, maybe for a week it would be difficult. But unless you are making a huge game out of like a PUBG kind of game on your
Yeah.
own, you won't face those many challenges because right now you are in the beginning phase. Whatever error you are facing, believe me, other peoples have already faced. You just need to copy paste the error on the Google, not just even ChatGPT, and there will be. I am 100% sure that first five result of the Google will already show that same error that you are seeing and with the solution. There is a very famous website, Stack Overflow. Before ChatGPT, I was one of the chronic user of that website to troubleshoot my error because I used to jump fastly from one programming language to another. This is an advantage of me being a doctor because I don't work for a company which bound me to work on a specific language, let's say Python. Today I am having a mood to create a mobile app. let's say for pathology learning, for LMS, to create an LMS, or let's say for anatomy, learning about bone. So I need to work on Unity. So today I'm learning Unity, but there are some recently made changes. So now my laptop is not responding properly to the command that I gave because the library has been updated. I just copy paste the error to the web, and there are support documents that can easily help us. Once you understand like how to look for it, it becomes very easy. And I have learned from very good AI engineers. They don't like rectify the things like this is how a code would work. First I need to clean this, then this, because every approach would be different. Let's say if I'm working on some AI program for radiology, then my approach would be different. For X-ray, there are images already, there is one image per X-ray. So I just need to compress it to a smaller size and create a model. But in terms of pathology, when there is a whole slide image, one single slide would be of 15 GB. So that is a huge in-load memory. So it would crash my laptop. It won't even load it. So what I will do is I will break it into small tiles of 255 by 255. This is one of the common practice. So there will be smaller tiles will be there. So I need to write like load in memory smaller tiles. For example, 6 or 7 tiles out of 1,000 tiles, and then stitch them in the end when everything has been made. Then in the end, stitch it back. So that in that way, my laptop won't crash. My program will be made easily. So it will again use. It will be dependent on use cases, and you will develop this habit once you have a basic understanding of programming language. It is not that hard.
Exactly. I think you need to like practice more to learn more.
Yeah,
There is one
it is same
quickly
as
we'll
with practice.
quickly
Yeah.
we'll take one more question about how can physicians optimize medical coding practices to improve accuracy and compliance.
To improve the accuracy, first you need to have a basic understanding. Then,
Yeah.
for thing, let's say for example, for any medicine part, you create a app, AI app for lifestyle disorders, prediction of hypertension or prediction of diabetes model. For that particular problem statement, you need to have a good data set. As Dr. Ghosh also mentioned in his presentation, a good data set is required to create a good AI model. A common saying in the AI world is garbage in, garbage out. If I'm giving a raw data which is like and I'm giving anything, I won't expect my program to give me output of a correct diagnosis. So if I'm making a diabetes prediction app, I need to give like what are the different things that are required to predict diabetes. So if you are a medical student, let's say, or if you are an intern working in a ward, so what are the things that you see in history taking apart from name, age, gender, although these will also play an important role to for diagnosis. For example, if certain disease occurs more in female, that would be a statistical data of importance in certain problem statement. Then you need to have a like blood sugar fasting. You might also need HbA1c. So these are the things that we see on the rounds in the like notes of the patient or in the OPD. So what are those things during our PG? Those who have done PG or who are in PG, they create a master chart for their thesis.
Yeah.
So while creating the master chart, don't they spend a decent amount of time? Is it like today I woke up with an idea, okay, okay, I will make a thesis on thyroid tumor prediction, and I don't have any idea about thyroid, I don't have any idea about tumor, and I'm creating a data set. That's not the thing, na? We
Yeah.
spend some time on researching. Like if I want to create a thyroid tumor prediction on pathology, let's say, and this is my thesis topic for my MD, then I will search on Google Scholar what are the recent articles published on this. For thyroid, what are the things that I require? So I make a notes of those things. Then I create a data set. So this is one of the first step that should be done. Right now, what is the ideal practice? This should be the ideal practice. What is the caveat here is what people are doing. They think that within 6 months we will create a thyroid tumor prediction app, but they don't research in beginning. They took what do they took? They asked for the patient. Okay, swallowing is done. What is the name? Is gender of the patient? They didn't even feed in the computer what is the USG report, and now patient has taken up out that USG report with him at the home. After 6 months, he gave me the data of 1,000 people, and he says, "Okay, sir, create a model from this." Why, brother? the most important thing for this is USC report, biopsy report. You didn't even took the data in your data set. So the data set creation is one of the most important aspect, and one should spend a decent amount of time for better accuracy, because otherwise from age gender what will I predict? There is
Yeah.
nothing to predict on using this kind of data. So for better accuracy, your data set should be the best one.
Yeah, yeah, definitely.
And for
As
the
Dr.
compliance,
Ghosh, sir.
just to answer one more thing, you may ask for compliance also. So for compliance, there are HIPAA guidelines, and there are like DPDP in India, the Digital Data Protection Act. So one should be basically aware about, we shouldn't share the patient data publicly, at least not with their names and basic identification detail. Let's say for example, if I have a CBC report, if I'm saying that a patient, 31-year-old patient having hemoglobin of 10 grams, then it doesn't affect anyone. But if I'm saying a patient named Ram, resident of this and this area, then that is completely wrong. We are not respecting the licenses, we are not respecting the ethical guidelines. So one should be aware about these things. With time, everybody will get to know. It's not a one-day task.
Yeah, definitely. I think even Dr. Ghosh sir in his session mentioned the importance of correct documentation of the data, and you also mentioned how like garbage in, garbage out. We have to be very vigilant about what data we are collecting and feeding AI with, of course, taking into account all the ethical considerations. We will definitely carry out these conversations. In our doctors AI WhatsApp channels. And thank you so much, Dr. Ghosh sir and Dr. Tiwari sir, for such a interesting, enlightening session. I'm very, very grateful for both of you for taking time out. I'm sure all the people who attended learned a thing or two. Through this session, and that's the aim of this Med AI Web Hour. Thank you so much. Thank you. We'll keep the conversations around artificial intelligence and medicine going. Thank you.
Thank you so much. Thank you.
Thank you.
Bye. Good night.
Good night.
Good night.